Good afternoon, dear friends. Natalia's with you on the Just a Doctor channel, where I share my personal experience and answer your questions. As practice shows, quite often patients suffering from joint diseases are engaged in self-medication, which can often lead to serious consequences. This happens if arthrosis is mistaken for arthritis or vice versa. Each of us sometimes does not think about the possible risks when choosing a particular treatment tactic. Arthrosis and arthritis, as two consonant ailments, can be learned to distinguish from each other by the nature of the pain syndrome. The pain in arthrosis is mechanical in nature. It occurs under the influence of heavy load throughout the day and subsides during the night rest period. With arthritis, the pain has an inflammatory character. It occurs out of connection with physical activity, most often in the second half of the night, closer to the morning, while it is accompanied by stiffness, in other words, tight mobility in the joint. From the point of view of the pain syndrome, it is easier for patients suffering from arthrosis to climb the stairs than to descend from it, and for people suffering from arthritis, on the contrary. For people with arthrosis, starting pains are characteristic. These are short-term pains that occur for 20 minutes, appearing at the moment of the beginning of motor activity, which gradually pass in the process of movement. After the manifestation of physical activity, the pain with arthritis subsides in the evening, and with arthrosis, on the contrary, it increases. According to the results of the data of the conducted laboratory examination, with inflammation, as a rule, there is an increase in the rate of erythrocyte sedimentation in the blood taken from the finger, and an increase in the C-reactive protein in the biochemical analysis of blood taken from the vein. Each specific type of arthritis is characterized by its own individual changes, and first of all in the biochemical analysis of blood, which you need to pay special attention to. In gout, this is, for example, an increase in uric acid. In rheumatic arthritis, this is an increase in anti-streptolysin O titers. In rheumatoid arthritis, this is a qualitative or quantitative increase in rheumatoid factor and ADC. When examining the affected joint, first of all, you need to pay attention to its configuration. At the same time, compare the size and shape of the two joints on the right and left sides. In the presence of inflammation of the joint, as a rule, it increases in size, the skin above it acquires a reddish hue, it becomes hot to the touch, the volume of movement in the joint is sharply limited. This condition is most characteristic of arthritis. With arthrosis, there is a persistent deformation of the joint in the absence of obvious inflammatory changes. The most valuable information about the presence of a pathological process in the joint can be obtained by conducting an X-ray examination or computed tomography, as well as magnetic resonance imaging of the joint. All of the above methods of examination will help us determine arthrosis or arthritis, and in the future, decide on the tactics of treating a particular disease. Subscribe and be healthy.